Hello, Pain Free for Life members. Welcome to today's 10-minute Monday training. Today, we're going to continue working down our list of top voted topics for these 10-minute trainings by talking about treating tooth pain and oral issues with microcurrent therapy. So first off, when dealing with oral treatments, all of our devices are going to be equal for 90% of issues. So whether you have a Genesis device or whether you have a Pinnacle, the only thing is Pinnacle is going to edge out for nerve damage and soft tissue repair, which is the truth whether it's for oral or not. All of the devices here have some sort of anti-inflammatory program. So we're going to cover the programs and what they might do before we get to how to actually do the treatments, okay? So number one, inflammation. So inflammation equals pain. So we need to use anti-inflammatory treatments. And pain and swelling are likely to be the main things that are bothering people when it comes to dental and oral issues, right? This is where a lot of people come to us. It's toothache, sore gums, inflammation, all sorts of things like that. So all of the devices have some sort of anti-inflammatory program that's going to help. So 121 hertz, blue stimulation, 350 hertz, modulate, Pain, etc. All of these modes can be used in different situations depending on the device's capabilities, the specific capabilities of your device. Obviously, if you have a Genesis, you've got blue stim and 121, but you don't have 350, modulate, or Pain. So really, all of these are going to functionally do the same thing, again, with Pain edging out because it's a mixed program that does a lot of different things. So all of these modes will be what you would do. So if you have standard pain or inflammation, you would want to use your anti-inflammatory modes. The second thing to know about when it comes to oral and dental treatments is scar tissue. So here at Pain Free for Life, we understand that scar tissue is a problem not only because it can cause pain, but because it also blocks the electrical conductivity of the body, and it becomes one of the root causes of degenerative breakdown. And just like surgeries on other parts of our body, dental surgeries, dental procedures will also create scar tissue. Moreover, the entire dental system is connected to meridians in our body. And so when we have extractions or we have to have some sort of minor surgery or dentures put in or anything like that, what we're going to be doing is creating scar tissue that is going to contribute to chronic disease in other ways. So this is going to create pain and discomfort in the body. It's going to create more swelling and pain in your mouth, but in the long run, it's also going to be affecting the rest of the body too. So treating the affected area with 77 hertz is your key treatment option here. So whichever device you have, 77 hertz. However, this will neutralize the electrical buildup of the scar tissue and allows normal body communication. But what we want to look at as well is that the entire dental system being connected to meridians in our body is absolutely critical, because this means that by having a tooth extracted or having some sort of surgery done in a part of our mouths, we're going to be actually impacting organ systems in our bodies, right? So remembering that when we clear this scar tissue in the mouth, we're going to be allowing normal body communication to be restored. And this is even going to have an impact on organ systems associating with these meridians, and it's going to have a significant impact there. The next thing is soft tissue repair. So this is one of the rare things. Again, most of the time when people are coming to you and saying, I've got these dental problems, I've got a problem with my tooth, it's to do with pain. It's not to do with gum recession. But gum recession is something that people have worked on successfully in the past. And the key frequency here is 90 hertz, which is programmable in the ProSport 3 and ProSport Ultra and readily available in the Avazia Life Pinnacle as Sana Soft T. This program should be run daily for 3 to 5 minutes. Those without these devices can use 77 hertz as an alternative. It won't be as effective, but it does work reasonably well as a substitute for soft tissue repair, okay? So you can kind of sub it in there, but if you have the Pinnacle, if you have a ProSport, make sure you use 90 hertz because it's that precise frequency that is what we want. Okay, and the other thing that people tend to come to us with are much bigger issues like bone loss right? So bone repair and nerve repair. So repair of bone from bone loss as well as repair of nerves is significantly harder than the other treatments already covered. And this is where we get into the kind of 10% of treatments that can't really be done with the evolution or the genesis as well as the pinnacle. So those who have worked on these issues and resolved them have spent sometimes months, sometimes even a couple of years working on this issue because they wanted to avoid whatever the other option was that the dentist had given them. But when they've worked through this, when they have proceeded to treat for a few minutes a day over a period of time, they have gotten the results they wanted. So excellent results were finally achieved. For bone, you're going to want to use 7 hertz. So if you have the evolution, you could substitute 7 to 12 hertz here. And for nerves, you want 2 hertz. There's not really a proper substitute for that outside of the Pinnacle and the Pro Sport units. With the speedy results achieved by the new Pinnacle modes, I would imagine that these times may be considerably shorter now compared to how they used to be. People who are using the Pinnacle and the special customized modes are turning around to me and saying that they're getting results way faster, even of things that were just really slow before. But now one treatment, one cycle a day is really speeding things up. The timeline going from what they've been working on for 6 months to a year, going down to 2 weeks to see change, right? Really fast. So if you are using the Pinnacle, you should use SanaBio 2 for nerves. So it includes 2 hertz for nerves and SanaBio 7 for bone. Okay. So these are the basic dental/oral issues and what we can use to treat them. But the question is, how do we get these frequencies into the mouth in the first place? Well, the first and possibly the simplest option is to simply place your device right over the cheek to allow the current to pass through the tissue and into the teeth. So if you've got a toothache kind of up here, you can just place the device there. It's going to pass through. You're going to feel it in your gums and teeth, okay? So you can treat from the outside in. It's pretty easy. This is also how I recommend doing dosing and zeroing. If you're trying to bring in some dosing and zeroing because you're not getting results, hold it directly on the face and just let it go. So yeah, in practice, this works quite well, and it's especially good for the sensitive individual. If you want to work on the teeth directly, I actually recommend using the tongue stimulator. This device is designed to be placed in the mouth, and it can bend, so you can even put one prong on either side of a gum and kind of just rest it in your mouth like that. So this allows you to get this direct contact with the area, which will be a little speedier. So as long as it's comfortable, it's a great option, and it's probably, you know, the most recommended option if it's something you want, somewhere you want to go with, if you want the speedier results. You can pick the tongue stimulator up on the sanashop.com, or I believe it is included with the Pinnacle kit. So for those of you who are looking to take a deeper approach, the other option that I've seen work quite well is the Via Chi. And this is a tool that I know has been really popular for these types of treatments because you can treat directly without having to have any contact or any sensation, and you can treat the different areas as they're hurting to get that depth in, drive it deep, and you'll see the results you're looking for. Okay, so that is it for today. Thank you to everyone for joining me live. If you enjoyed what you saw today, if you found it helpful, as usual, I'm going to ask you to just like the video, leave a comment below. Let us know if you have any questions. The truth is that when people like the videos, leave comments, it bumps it up and more people see the video, which is just awesome. It helps everyone else out. Otherwise, it gets buried in all of the questions that come up on the page. But if you have any questions, feel free to leave them in the comments. I'd be happy to answer them. Any specific dental issues that I didn't cover here today, I'd be happy to answer those as well. Otherwise, I hope you all have a phenomenal week. And I will see you next week, same time, same place, for another Monday 10-minute training. Take care.